Hello, everyone, and welcome to Living Well with Dr. Sheila. I am your host, Sheila Craig Whiteman, Doctor of Physical Therapy, and my weekly show is to target any and everything to help all of us live well, live better, be more happy, and spiritually, physically, and mentally enjoy life. Thank you so much for joining me today. I am on, of course, every Thursday at noon, but you can also catch me on reruns because I do stream it onto Facebook. So if you miss me on KP Media TV through Roku, Amazon Fire TV, and Google, you can always catch me there. And I will be more than happy to have you as part of my audience. Today, we have actually a returning guest because she has been with us a few times and she'll be with us a few times more because I'm going to keep convincing her to come back and share her knowledge with us. But I'm going to slip my glasses on, and you know I have to look over to read. We tell you this every time, but I have to look over to read my stuff. So we are having Janine Batie-Gray, and she recently retired from Merck & Company as a neuroscience medical Science Liaison Director after 27 years of service. She received her Bachelor of Science in Chemistry from Dillard and her Doctor in Pharmacy from Florida A&M. She is a licensed pharmacist. Janine has a special interest in health disparities in the African American community. She recently established a health and wellness company named Naomi's Journey to Wellness, which will provide formal and informal disease state presentations to healthcare professionals, patients, and caregivers. Her goal is to provide information to help patients become better educated about their disease, such as diabetes and sleep, so that she will improve communication with their doctors and other healthcare providers. So that fits right in with the mission, right? The mission to help all of us to live better and to live our best lives. I am going to bring Dr. Janine Batie onto our studio. Here she is.
Hi.
How are you?
Hi, Dr. Sheila. Good seeing you again.
Good seeing you again, too. And as you might remember, you may or may not remember, but Dr. Janine and I do know each other. So I will slip and call her Janine. She will slip and call me Sheila because we do not call each other doctor in our social lives. So just know that. But we both are very proud of our doctor designations, but we just, don't use much amongst friends, but that's okay. So today we are going to talk about sleep and menopause. So Dr. Janine has done a lot of research on sleep. Actually, sleep is one of her specialties. So I wanted to bring her back to talk about the changes and challenges of having a good night's sleep during the menopause and perimenopausal years. Those of us who are there, or who are even coming close or whatever, you're starting to notice these changes. Not everybody, but most or a lot of women do. And there are reasons that this occurs. So this will be a great discussion for us both to have. So the first question after all that, Janine, is can you talk to us about why sleep is important?
Absolutely. And again, thank you so much for inviting me again to be on your show. I so enjoy our time together, and particularly being able to help others improve their health. So thanks again for that. And so, I just got interested in sleep when working with Merck and Company, and I never thought of it as being so important. But what I found after working in that therapeutic area, sleep is so important because it controls so many things in our bodies. Particularly, it helps to restore our energy, it rejuvenates our body, it controls our blood pressure, our mood. It also helps us to learn and also make memories. But more importantly, at this time with COVID running rampant, it also helps fight infection. And at the end of the day, it can also control your appetite, because if you're not sleeping well, you may be getting up and going to that refrigerator and nibbling on things that you probably shouldn't have at 2, 3 o'clock in the morning. So if anything, focus on getting good sleep. But there are a number of reasons, most importantly at this time, fighting infection, I would say, would be at the top of the list.
Agreed. Yeah, I agree, especially during this time. Yes. I also, and I think you have alluded to this, and I was just glancing at our questions to see if this is one of the questions, but you had alluded to this with one of our other talks, and sleep and just the importance of that in memory, the importance of
Yes.
that of rejuvenating your brain
Yes.
for optimal function.
Yes.
So sleep. She mentioned a lot. Sleep is so important for just so many things.
Yeah.
But we're going to talk today about women and sleep. So why do you think women have more sleep issues?
Well, even at the beginning of onset of menses, sleep is what starts it. When menses, you have sleep disturbance as starting your cycle when they're 12, 13 years old. And then as you transition through life, you have babies. Of course, we know that they impact our sleep, particularly early on. And then I would say once they start driving, that probably keeps us awake as well till they get back home. But when we get into perimenopause and menopause, data has shown about 12% of women have difficulty falling asleep, even outside of perimenopause and menopause. But once going into menopause, you'll see the numbers, the percentage increase to almost 40% of women have difficulty going to sleep during perimenopause and menopause. And so you can imagine every night having these difficulties in falling asleep. And there are a number of sleep disorders that are now being shown to occur very often in women. But when you look at menopause, we probably could all relate to having many of our friends having hot flashes. And hot flashes is probably the number one issue once with sleep once you go into menopause. It's the body then feels this sensation, this heat rises, you then go into sweating, and all of a sudden, if you're asleep, that will wake you up. Then you're soaked, you have to get up, change your clothes if it's and some people have it that significant that they will actually be drenched, and so that's one big issue, is the hot flashes that impact our sleep, and then just like many women already had problems with insomnia. And insomnia is probably one of the number one sleep disorders that affect women. And that is because insomnia, as you know, you have difficulty falling asleep. You can't, and that occurs usually 3 nights a week, and it could go on for about 3 months. But difficulty falling asleep, staying asleep, and then you wake up and you can't go back to sleep. But I know we had this discussion before, because it does relate to your favorite topic about getting up, going to the bathroom.
Yes.
And that would be another issue that you would probably encounter during menopause. And so there are just a number of sleep disorders, but the hot flashes is what drives it in menopause outside of the insomnia. And then one last one would be having obstructive sleep apnea. And the issue with obstructive sleep apnea is it's just being diagnosed in women, but in menopause it occurs more often now, and that's because we lose estrogen and progesterone and those estrogen and progesterone helps with maintaining mood, sleep, and also appetite. And so loss of that then drives you to one more sleep disorder of sleep apnea. And of course, you typically gain weight during menopause. And so that's another factor that's why it's so important for us to have these discussions and understand. But sleep apnea, having to have a sleep, machine at night, because it can become that severe.
Yeah. And so the loss of estrogen, number one, is normal.
Yes.
So that every woman is going to experience loss of estrogen. That's what the peri-menopause, menopausal year is. So, and menopause is menopausal estrogen actually is a hormone that regulates so much.
Yes.
So you wonder why during this time period you just may not feel as energetic or may not feel your and another reason why you just can't sleep, just everything.
Exactly.
It's just odd.
Yes.
So you have to do a little bit of extra effort.
Yes.
In order for to mitigate some of these changes that are occurring in your body. And now sleep apnea, and I'll put you on the spot. If you can answer it, you can answer it. So how is that diagnosed?
Well, sleep apnea, your bed partner, if you have one, will say you stop sleeping, you stop breathing at night, or you wake up gasping for air and you snore like crazy, like a train. And, most men were diagnosed with sleep apnea. But prior to going to menopause, you may not have had an issue with it, or some people who are overweight may have already had an issue with it. But going into menopause, typically you gain weight unless you're really, really focused on that, controlling your weight. And then you don't have the very large neck that most men have and the big bellies. Now, women will get a lot of, middle
abdominal
fat around the abdominal area, but not as significant as men. But most times the bed partner will say, do you know you stop sleeping at night? I mean, you stop breathing or you're snoring. I just can't get any good rest. So you will have to go to a sleep specialist and they'll do a sleep test. They send you into a clinic and you'll spend the night, and then they will actually take measurement and timings of how long you stop sleeping, just kind of give you a readout of what's going on in your sleep. And then the diagnosis is typically made that way, and then you're fitted with a sleep machine to go home with. Now, they have improved tremendously. There used to be these very obtrusive things, I would call them, on your face, and a tube attached to machine on the side of the bed. But I've seen some very more sleek, trim, slim looking machines now that are not as obtrusive, and because a lot of people won't wear them because they are so obtrusive at sleep, and they're a lot quieter than they used to be as well. So a lot has improved, but most times when you're looking at menopause and relating it to why now, that typically would occur. I think the numbers have gone from like 2% before menopause to almost 4% of women now will have sleep apnea in menopause.
Okay, I see. Yeah, and so for people who live alone, because everybody is not fortunate, fortunate, unfortunate, depending on how you look at it. But everybody doesn't have a partner. So I do know that another thing that I had read was that if you sleep and you think that you have good quality sleep, but you're exhausted.
Exactly.
When you wake up, that might be a sign too. And certainly, check with your doctor.
Yes, absolutely. That's your quality of sleep, or you're just exhausted. You got to drink a whole pot of coffee to get yourself started.
Right.
So you don't feel rested. is how
Right.
they
Hmm.
describe it. You're not feeling rested. And that would definitely be a clue there that, every morning you're waking up not feeling rested. So if you don't have that bed partner, that would be a good indication.
Right. I didn't want to leave people out.
Yeah,
You know,
exactly.
yeah, just
Because
in
we
case it did.
do
Yeah.
know there are a number
Hmm.
of women who don't have a bed partner.
Right. Yeah. Yeah. Exactly.
Outside of
Exactly.
the dog sometimes that gets in the bed with them.
Yeah, but they can't.
But
They
dog.
can't really. We love the dogs, but
Yeah,
sometimes they can't communicate effectively
exactly.
on what we
Exactly.
need. But you're right. You can sleep quite well if you do have that dog in your,
Yeah, yeah,
in your bed. They're
exactly.
excellent company. But so, what about? And I think we did kind of talk about this, but I always like to ask the questions kind of in order because we briefly talk about it in the previous question, but just to
Yes.
solidify it. But how exactly does menopause affect sleep?
The menopause, because the hot flashes and the sweating wakes you up. And that loss of estrogen, which if you had the estrogen, then it would be, you may have insomnia even before menopause, but it's really the hot flashes that drives this poor sleep. If you did not have insomnia before, it's the
Hmm.
hot flashes and the sweating, the night sweats that really
Hmm.
impact it. And to your point, waking up, not rested.
Yeah, yeah, and women, hot flashes are a big one. A lot of women sleep hot
Yes,
because
that,
actually it's not even a hot flash. The minute that you hit the bed,
yes,
you're hot
you're hot.
and you stay hot.
And you
So,
got the ceiling fan on and the
yes,
air conditioner, and you're
yes,
still hot. And
yeah.
I was reading an article in preparation for our talk today that said it recommends even sleeping in the nude if you are having hot flashes, because you're going to wake up and take all of that off. So I
Hmm.
guess depending on where you live and are you comfortable with sleeping in the nude, um, that was a recommendation on one of the resources I read.
Yeah, I had read that too. Uh, so many people are not comfortable sleeping in the nude, though,
Yeah,
honestly, because people like to have. I think it's comfort and having
exactly.
something on your body, which might be
Body.
something that has to do with even the weighted blankets that are so popular
Yes.
now. It's like
Yes.
you want something there for comfort.
Yes.
But certainly, if you got to wake up in the middle of the night and take your clothes off, then hey,
You might as well try it, right?
just nip it in the bud and yeah,
Just
just
try
give
it.
yourself like that
Have
4 or 5 minutes.
something close in case something happens during the night and you gotta leave,
Yeah,
So
yeah,
that's
yeah.
what
Put
I
that
think
little
of.
robe on the bottom of the bed. Yeah,
Yes.
that's right. Because you do always want to have that plan B and be prepared.
Plan B just in case.
Yeah, yeah. But certainly, yeah, agreed, agreed. And what are the most common sleep issues that are associated with menopause?
So, as I stated, I think when you look at insomnia would rank number one. And insomnia, because insomnia is so prevalent even before going into menopause. And so it would rank, I would say, out next to hot flashes, insomnia. And then, of course, what we just discussed, the sleep disorder breathing or sleep apnea. But insomnia, people have to remember there's acute insomnia and there's chronic insomnia. And so typically when you go into menopause, you probably will have chronic insomnia until you understand that you're experiencing insomnia. So 3 to 4 nights, you're not going to sleep well. You have difficulty falling asleep. You have difficulty staying asleep. And then once you wake up, you can't go back to sleep. So those are the three signs that you are what we call an insomniac. So with that, going to a physician, having it properly diagnosed, because of course that would be diagnosed very differently from sleep apnea. You typically don't have to go to a sleep clinic. You won't spend the night. It's just how you describe your symptoms. And then the doctor will say, oh, it sounds like insomnia. Now, when you have been with someone for a very long time and that person dies and you're sleeping alone, that could cause insomnia because you're so commonly used to having someone in bed with you. So that could cause acute insomnia, and sometimes it can transition to chronic insomnia. So you do want to have that treated as well, because you, again, the importance of getting good sleep and the reasons why you want to have good sleep. One is for those preventing, dementia, Alzheimer's, moving forward, and then just to improve your overall health, blood pressure and things like that. That's controlled by good sleep. So that's another, I would say the three main ones are those, but there is some data that relates to restless leg syndrome, where you're shaking your legs uncontrollably at night. When you get up and walk around, it's fine, but if you lay back down. So restless leg is also getting some traction now. People are understanding, and because it is a sleep disturbance, and particularly if you're sleeping with someone, they'll say, your legs are moving all night, you're disrupting me. So restless leg is another. I did not include it today because it's not as prevalent in menopause. Actually, looking at that data, it really occurs during pregnancy. And if you get restless leg during pregnancy, sometimes it will continue on once you've even had the child. But restless leg is also a common disorder in women as well.
That was interesting. Yeah, that was really interesting. And then the for insomnia, chronic is referred to as having those sleep issues for how long?
More than 3 months.
More than 3 months.
Okay. Acute is less than 3 months. Chronic would be greater than 3 months.
And if I woke up at night but was able to go back to sleep, I guess in a reasonable time period, whatever.
Yeah. And reasonable is, are you going to go back to sleep in 30 minutes, in an hour? And it depends on what you do when you wake up. So if you wake up and you turn the TV on, or you get your iPad or your phone and you put it in front of you, that light is going to wake you up. Your brain says, oh, I see the blue light now, I'm up. And so that's one thing we do strongly discourage is turning on lights, picking up your computer, laptop, iPad, phone, turn on the TV. It's best to maybe, take a sip of water and just lay there, and hopefully you'll go back to sleep. But don't get, and now if it lasts, say, more than 30 minutes, you're tossing and turning, it might be better to get up and maybe move around, come back to bed, because it could be torturous to just lay there and you can't go back to sleep.
Yeah, because then your mind starts wandering.
Yes.
Another problem, actually, I think, with the lack of estrogen is that you just start, that vicious circle of I either have to do this, or, I'm worried about this, or, whatever, because there is a mental, psychological component to
and you start going, I can't go to sleep. Why can't I go to sleep? So you start ruminating about why you can't go to sleep. So
right, it becomes cyclical. Yeah. So can treating menopause improve sleep?
Yes. Now, the two main treatments that they recommend for treating the menopause is the estrogen therapy. And some women, it improves. Treating with estrogen improves the menopause, therefore it improves because you're adding estrogen to your body that you've lost, or hormonal replacement therapy. Now, of course, that brings its own issues. Not a lot of women can take the hormone replacement therapy because they've, either have heart disease, they've had a heart attack, or they've had a stroke, or they even have cancer. For a long time, it was not recommended for those who have had breast cancer. So the physician really needs to strongly consider it. They say a short-term therapy may help, HRT, hormonal replacement therapy, but that they need to be very careful about prescribing it to a woman who's had, the cardiovascular issues, as well as the cancers. So those are what we call treating the menopause. But there are some treatments for the sleep disorder. And so that could be CBT, cognitive behavioral therapy. And that's the non-pharmaceutical therapy. And you can use that, you need someone who specializes and has been trained as a CBT person. Not everybody can do CBT. So cognitive behavioral therapy, and it actually helps to retrain your brain and your behaviors about going to sleep, because some people get so stressed because they know they can't go to sleep that stresses them in itself. So CBT is a good way of a non-pharmaceutical way of treating the sleep portion of menopause. And then, of course, there's other pharmaceutical drugs that are also used to treat the sleep part of menopause.
Okay, and I think I'm going to ask you about those medications later, because
Yeah.
I know that you know. So, so we're going to talk about those, actually, towards the end to kind of solidify, okay, so we listened to this whole thing. So what can we do?
Yes.
So, yeah. So I also did want to say, because you did talk about the hormone replacement, because, as a pelvic health coach, pelvic physical therapist, I have looked into a lot of that stuff too. There is a window, like there's a window of opportunity for for you to even start that, if that is something that you're considering, or if you're even looking into.
Yes.
You have like a 10-year window.
Yes.
And then after that, it is a no-go. You're treating
Yes.
everything symptomatically without systemic hormones.
Yes.
Mm-hmm.
And that going back to the hot flashes too, when I'm reading about that, sometimes the hot flashes can last anywhere from 7 years to 10 years. So
yeah,
they
can last longer than that, because my mom gets them on occasion. She's in her 80s.
Oh wow, yeah.
Mm-hmm. Not that often, but they will pop up every once in a while.
Everyone. And it's interesting because when I was working in the sleep therapeutic area, I actually talked to one of the scientific leaders about the sleep and menopause. And really, it depends on how you can really go back to your mom's medical history, gynecological history, to determine how your menopause will be.
Mm-hmm.
So if your mom had very bad menopause, and I know a number of friends that I have that will be in that hot flash, sweating, taking clothes off, you're out to dinner, you're like, okay, they're fanning, all of that. And if you ask them, how was your mom's menopause? And it's exactly the same way.
Mm-hmm.
So there are a number of things that you can start looking at. If you're a young woman, start paying attention to your mom's gynecological health as well, because it kind of gives you a preview into what yours would look like.
Yeah. And then, and also research then either dietary changes or different changes that you can make.
Yes.
If you don't want to see that repeat in yourself.
Yes.
Because there are interventions. We mirror our parents and our family's history, but you don't have to mirror it exactly.
Exactly. You can change some of that. Genetically, if you are eating and living the same way, then you'll probably turn on that gene, is what I call it.
Yes.
But you have to be intentional about it. And I think, and that, that brings us to some of the things that you could you could try at home to help if you are having poor sleep, and maintaining your weight is one of the first things, because we were discussing sleep apnea. That is because of weight gain, and you typically get weight gain during menopause. So you have to be intentional about your diet during menopause. You have to be intentional about limiting caffeine. Even, caffeine is in tea. You think you drink tea at night, you have to read the label. There may be some caffeine in the tea that you're drinking. Be able to drink plenty of water, not too close to bedtime, because we don't want to go into that
Right.
urinary issue, and having to get up to go to the bathroom. Don't eat too late.
Right.
After 5 or 6, be careful of what. And alcohol plays a huge issue. A lot of people will think, oh, we'll have a glass of wine before going to bed. Well, that same wine a couple hours later will keep you up, and so you have to be careful about wine. And some wines will cause hot flashes. So you have to be careful about what you're drinking, what you're eating, your habits before, as we talked about briefly, about not having the TV on, putting the iPad or computer down, the Facebook page, close your social media, get some quiet time, read a book, listen to some nice music, a warm bath. All of these habits that you could start and create to get better sleep, that will be on you, to get the better sleep, to be intentional about getting sleep. And the time, go to bed at the same time and wake up at the same time. So those are just some tips for your listeners and viewers to try if you're having sleep disorders, or difficulty with sleep.
Yeah. And that going to bed at the same time and waking up at the same time, that even includes weekends, audience.
Yes, even includes weekends.
It includes weekends.
Yeah, and that's where I kind of can fall off, because I love to sleep, especially on the weekends.
Yeah, I think that's where a lot of people fall off.
Yeah, it's like, oh, I can sleep till 9, So, but yeah, being intentional about it.
Yeah, and even going to bed later. And this is not saying that you can never, go out and, get home, and have to rush home because you got to go to bed at 10:30.
Exactly.
I mean, it doesn't mean that, but it just means for, as with any lifestyle habit, the majority of the time.
A majority of the time. That's a perfectly way to say it, because there are some times where you're going to be out late. Well, with the time that we're in now, most people aren't going too far out there, but
depends on where you live.
Yep. Yes, depending on where you live. And I'm in the South, so we're being very, very cautious about where we're going. And then just I would say, for me, the TV is the big, stimulator of poor sleep. If you're watching TV, particularly the news, before going to bed, could stimulate then anxiety. I mean, just looking at the news today with New Orleans, what's going on in that city, all of that could bring forth, some anxiety, especially if you know people who are in that location. So being caught, again, understand what's going on, stay in touch, but don't just play it 24/7, because that will impact your sleep.
Right. True. Yeah. So, what are the most common treatments? And you kind of said the ones that are things that you can do without intervention.
Yes.
Medical intervention. And we'll review those again, because I think those are kind of really important, because if you can get most of those tips down, you can probably improve your sleep habits if you don't have any underlying issues.
Yes.
Because you have to take that into account too, if there's an underlying
absolutely
issue.
Because if you're in pain, that's going to impact how you sleep. And some other chronic disorders will impact, arthritis and things like that could impact your sleep. So this is a relatively healthy person who is in menopause, and the sleep is just poor sleep. So
right. But what are the most common treatments for menopause?
So the yeah,
for sleep in menopause.
Sleep in menopause. So just like if you don't have menopause, treating sleep disorders, you can use, well, the most common things people are familiar with are the class of drugs. Benzodiazepines are commonly used, and those would be like the Valiums. You have the non-benzodiazepines like the Ambients, the Lunestas, and things like that. But you also have, which has been studied and been shown to be very effective, is antidepressant drugs. And because they help with the hot flashes, which seems to be much more of a problem for menopause women versus just having insomnia alone. So the antidepressants would be a good class as well. You know, the estrogen replacement therapy, if you could tolerate the estrogen, that's also very helpful because you're replacing that loss of estrogen. And then as I said, other common ones, the Ambience, Lunestas, and there's a orexin antagonist, which is an area that I was in at Merck and Company. That drug also treats insomnia in general, has been looked at for menopause. Not sure, I haven't looked up to see where the studies landed with that, but looking forward from when I was there may be some more studies that have been done in menopause, because we do know that menopause is a huge sleep disorder. That's one of the special projects I actually worked on. And that's what's really piqued my interest, because I know so many women who I just meet every day and just say, oh, I'm having trouble with sleep, that's menopause. And it's just a common discussion, you know, just with friends in general. And so looking into how we can treat it pharmacologically. Now, there are some black cohosh. I have not, the studies don't look very impressive. And remember, these drugs are not regulated by the FDA, but the side effect profile, a lot of people can't tolerate it. There is another one that I had not heard of called red clover extract.
Yeah.
And it's a plant. And actually, it looked pretty impressive. It does a lot of things for sleep, mainly sleep and overall health. It decreases blood pressure, boosts your immune system,
Right.
it lowers cholesterol, and then ultimately it can help increase estrogen. So I think this is a plant that probably, if you want to stay more in the non-traditional pharmaceutical drugs, those may be options for patients as well. And then I saw ginseng is one that was also very commonly used. And because one of the things it does is improves mood. So you think if you can improve mood, then you will also relax and get better sleep from it. So they're all a part of a class of drugs called phytoestrogens. And so that's why they have some impact on estrogen and could definitely improve sleep, because that's what's really occurring is the loss of estrogen in menopause.
Yeah. And the things that she mentioned, estrogens derived from plants, you can actually eat some foods that can enhance your estrogen, in your body too. So there are a lot of different things.
More natural.
Yeah, more natural.
Okay.
But let me ask you a question about, since you are a pharmacist. Let me ask you a question though about the prescribed drugs and how long can you take, and it might be different from the different classes because you named several different classes, but how long can you take them before you should stop, or do you get dependent on them? Just kind of talk about that a little bit.
So in general, to just treat insomnia, I mean, most of the studies have been a year-long study. And so that's typical 52 weeks. Now, Some people get on drugs and say it helps and they can't get off of it and they just stay on the drug. So it really depends on that particular patient, the side effect profile, and the doctor who's monitoring the use of those drugs, because some you can get the dependence on them. And that's the big issue. They're controlled drugs. It's like the benzodiazepines are controlled drugs. And so you want to be very careful about how long you can stay on those drugs. Personally,
Question.
mm-hmm.
Bizodiaz, whatever.
Benzodiazepines,
Yes.
like a Valium.
Thank you, because
Yeah.
you can say
A
that, but
pack,
we don't know
yeah.
what that means. Yes.
Yeah, a Valium would be, that's the oldest one. There are tons of those drugs. Ambien, those are newer. They are called non-benzodiazepines because they act in a different pathway. The Ambiens and Lunestas, and they've been their side effect profile. You could get up and go driving at night, and that was a big issue with those drugs. And so they are used very cautiously, and then you don't want to get dependent on them. So a lot of people don't want to take those types of drugs because of the side effect profile. They were in the news for a number of things. You're driving, you're eating, and you don't even know you're eating. So, those class of drugs, although they can be very beneficial to someone who's really, really needs to go to sleep and get control of their sleep problems, you do want to monitor how long that patient stays on it.
Mm-hmm. Mm-hmm. Okay. So, okay. Yeah. Because if the problem is really severe and you are not sleeping, sometimes prescription drugs are appropriate.
Yeah.
But I just, yeah, because I don't want anybody to think, this is horrible. Because for some people
Right.
it is necessary.
Right.
So
Absolutely.
yeah. So I just wanted to, kind of get a perspective from somebody who has studied drugs.
Yes. So
Yes.
always, I'm the one. Although being a pharmacist, I'm the one that, well, I want to take it short term. We'll see. I mean, it's just like a pain medicine. If you're in severe enough pain, you'll take a pain medicine, and it can be addictive as well. So you really, want to get on top of the side effects and understand, the addiction profile to those certain drugs. I mean, there's huge problems with narcotics, and they're off, on the back roads, people selling it at that point. So of course, the phone would ring now.
That's okay. I can put you on mute and I can talk for
Okay.
a minute. And
Okay, good.
Yeah. Yeah. So what I think is really interesting about this is that, and I'll first start with saying the analogy you said about pain and having to take a medication for pain, opioid, whatever, because sleep is very similar. If it is affecting your life and it's something that you can function, because you can't function without sleep. Let's just say that straight off. So if you can't sleep short term, or even if it's a longer term, if that is the option that your doctor, says for you to do, and you agree, because you have to certainly agree and you're comfortable with it, then, by all means, that is the way to go. Because sleep issues can be really devastating, really, really devastating. So.
And to your point that poor sleep now, with it leading to what we've seen with Alzheimer's and dementia. I mean, because sleep, you're removing those toxins from your body, TNF alpha and other cancer causing agents. And you want to be able to give your body, it's called a lymphatic system, that's working during sleep to remove those bad things from your body. And getting poor sleep doesn't give your body an opportunity to remove those toxins. And so that's another, when I learned that information, I focus on sleep. So I know if I go to bed at 11, what's my 7 hours to wake up? That's how specific I end up getting. And some days I do well, and then some days, I don't. And then
Mhm.
the other interesting point too, and women will probably get a chuckle out of this, is, we will hear anything coming at night. You wake up, what's that?
Mhm.
Um, but and sometimes the husband will too, or but he can't hear the baby crying. And we can hear the baby crying. So, so it's like, okay, well, they're just not tuned into that. But definitely women will always hear the baby crying, and the husband will not. And so that's where we are, the caretaker. And that goes into another subject, being a caretaker, which is another subject matter, for poor sleep. Women and others, men, who are taking care of a loved one, really gets poor sleep, because they are, of course, um, they're taking care of someone and
Always
listening
on.
to see if that person
Mhm.
is going to call their name. And so that's another huge population of people at this point, particularly, with Alzheimer's and dementia patients who may wander at night, or just get up, and then they're always, so they never really get to deep sleep, which is
Mhm.
also required to get into deep sleep.
Yeah, yeah. And so there's a couple of things I just wanted to mention to unpack from that, because you did talk about sleep and the lymphatic system,
Yes, glymphatic, it's called glymphatic system.
the glymphatic.
Glymphatic.
Ah, okay, okay,
Yep.
okay.
Yep.
The G?
With the G. Yep. It was a small paper that was done out of California, scientists out of California. Some people believed in the glymphatic system, and some people question what the glymphatic system really is. A very small paper. But packed with a whole lot of questions about the glymphatic system and its role in removing toxins from your body during sleep.
Interesting.
Yeah.
So I wonder if then if it is related actually, and you read the article, so maybe is it related
hmm
to the lymphatic system with an L?
hmm
The lymphatic system, because that is the function, that was, I am a lymphedema therapist, just
Yes,
FYI. So
exactly.
yeah, so just FYI. But so because that is the function of your lymphatic system, is
hmm
removal of viruses, bacteria, and to really clean
Exactly.
your system. So
Yeah.
so when you said that, and I was not familiar with a G,
Yeah. A
a
G.
G lymphatic. So I'm gonna have to look that up, because
Yep.
that's
I
in.
probably have the paper. I will look in my files and send it to you.
Okay, yeah, because
Very
I will
interesting.
see that. Yeah, yeah. Well, the body itself is just so, so interesting. So.
Yeah, I think that's why I've always been very interested in the medical field. And one of the
Hmm.
reasons why, I stayed in science, because it's just like, oh, that's connected to that. Oh, that happens.
Yeah,
Yeah. And it's
it's
just,
wonderful.
yeah, it's a system. And there's still lots to be discovered about the body, the human body, and what it can and can't do.
Hmm.
I don't think we're near knowing everything about it. What we can say now is we know, sleep is important, eating healthy is important, understanding the different diseases and major diseases that are impacting the U.S. population. We do have better understanding of that, no smoking, those kind of things to keep us
Mm.
healthy. But
Yeah,
there's probably a lot more to uncover and discover.
yeah. And we are going to come back at a later show, the two of us, and really talk about some of those subjects.
Absolutely.
Yeah, because knowing the basic health, and basic and not so basic, but
Yes,
knowing health information could save your life.
absolutely.
So, yeah,
Absolutely.
that's definitely on our calendar to revisit on the next Dr. Janine conversation.
Absolutely,
For
Dr.
sure.
Sheila.
Mhm. So, and we've talked about actually quite a bit. So we have really gone full circle with menopause, why, the whys, the hows. Let's talk a little bit about, before we go back to tips, but let's talk about the role of stress. And I only brought that up because you talked about how men can sleep through the baby sleeping, and they can be, at least I found, that they can be pretty stressed out in general. And I don't know if they let it go. I don't know how that works for them. I really can't figure that part out, because they can have like the most stressful job, the stressful day.
Yes.
And they go right to sleep. And you're sitting there like, what happened?
Exactly.
Yeah, like why can't that be me?
Yeah.
So
it must be the testosterone, the different hormone that they have versus
it probably has to be.
Yeah, because I'm always amazed at that, because when my daughter was young, I used to go, you can't hear her cry,
Oh, yeah, I know, right? Right.
You're like,
you wait a little bit. It's not like when they first start.
Yeah,
you get right up. You're like, oh, I know it's his turn. So he goes.
Exactly.
I know,
and
right?
You're like, hey, that's it.
And it's like, what is it? What is it? What? Yeah.
Yep. But
yeah.
I think it's just, and I guess because we carried the baby for so long, that's our connection, to the baby. But I just always find that very interesting, to understand that when you're, especially in a deep sleep.
Right. But and getting back to the stress statement. So one of the components too of getting good sleep, menopause and beyond and before, is that stress mitigation.
Yeah.
Because that will keep your mind rolling and keep it so that you just simply cannot get the restorative sleep that you need.
Yes.
So I think we would almost be remiss, because that almost goes up there with the hot flashes, actually.
And so before leaving and taking early retirement, I was that person. But I learned to use my phone to write in my note section of everything I had to do the next day. And when I started, or you can use a pad or whatever you have next to your bed, I write it in my note section, my to-do list for tomorrow. And that has helped me relax and figure out, okay, I don't have to do this today. I can do that tomorrow. So that helped my stress. And then I do use some yoga exercises before going to bed, to stretch, to breathe, in and out, deep breathing and out your mouth. So that also calms your nervous system. So those are some techniques that work for me. This is one thing I know I didn't say, is about keeping your room cool. And probably the husbands would be, and the other partners would be like, oh my God, it's freezing in here.
But they
because
still fall asleep and go to sleep though.
Yeah,
so whatever.
Between the hot flash, so you have the air on. And I saw a study that said that to keep the air on 65, I was like, oh my God, that is cold. I have mine like on 72 at night, and sometimes a ceiling fan. But they said 65. I was like, oh yeah,
I think that's way too cold.
That's too cold. Yeah,
like that would be the opposite. I would be getting up trying to find more cover at night.
And to put right, exactly.
It would not work for me.
Yeah, so making sure the room is cool and dark is the suggestion. So I do have those blinds and curtains that make it very dark. So you don't be, in the morning, you're like, hey, here's the sun,
Right.
But those are just some techniques in your room that will help. And then the kind of cover, like I have these cotton sheets that are so cool. That you just slide it. It makes you hard to get up in the morning because it's so comfortable sleeping. And then the kind of pajamas, early on you had these pretty pajamas, silk pajamas. Well, menopause, that you get rid of those, cotton pajamas. They breathe. And so if you do have a hot flash, at least it will, absorb some of the sweat. But there's definitely strategies that you need to use once you enter into menopause to make life much more comfortable, especially early on. There are a lot of women probably have some other techniques that they use that I don't know of, but those are just some of the ones that have worked for me.
Yeah, those are all really good suggestions. The only one, and we're gonna wrap this up with how to contact you. However,
okay,
I was just reading. You and I read off a lot, I just have to say. But I was just, we always like, I was just reading. But I was reading this article, and actually it might even been part of a class I took, really, that they were talking about how to stop your mind from racing at night.
Okay.
That was one of the issues that I had. I don't really have it anymore because I do better sleep hygiene, but I did.
Okay.
But they were talking about doing actually a brain dump too. So that's the expression of brain dump. So you just take a piece of paper or whatever, but you just write down, you take 5 minutes and you just write down whatever comes to your mind for that time period. If it's more, you can of course spend more time. After you do that, you throw it away.
Okay.
Yeah, like you tear it up and you throw it away because that's your dump. You have dumped all that.
You put it out.
And sometimes it's the act of actually physically doing something like that will, trigger your brain to say, okay, it's gone.
It's gone.
I'm good.
Yeah.
Yeah. So I'm going to try that. I am going to try it the next time I have a lot of stuff on my mind.
And I know a lot of women too. I've heard some say that they have a favorite prayer that they say at night. That's helped them calm their nerves. Depending. Yeah, it's just releasing it, letting go. Letting go, let God, or whatever it is that you practice to release. Whatever is going on. Yeah, and that way that helps with better sleep because. You gotta, as we were talking, we have to focus on getting better sleep because that is the goal, is better sleep. And what does that look like for you? I mean, some people say 6 hours and I'm good. They feel good. That's great. Some people say 7, 8. What is it for you that will make you feel rested the next day and
that's the main thing.
The next day and energy.
Right. So if people have a question about anything that we talked about, how can they contact you or can they contact you?
Yes, you can contact me. I'm on Instagram at Naomi's Journey, and it's the number 2 wellness. Naomi's Journey 2, the number 2 wellness.
And I'm putting this in the chat.
Okay.
2 wellness. And you can tell me if it's spelled correctly. Is there apostrophe after the S?
No apostrophe, just S.
And that's your IG handle.
Yes.
Okay. So I'm going to put this up if anybody wants to contact Janine. And we're going to end our conversation. The time went by so fast.
It always does, doesn't it?
Does that look correct?
Yes, that looks it.
Okay. Yep. So, So we're going to end our conversation right now. If you have any questions about this conversation, this topic that just, strikes you and you want to get in contact with Dr. Janine Batie-Gray, please feel free to do that. We're going to close up. Thank you guys so much for, you're quite welcome, Janine. Thank you all so much for joining us. And until next time, I will see you. Remember, you can see me every Thursday at noon. That's Eastern Standard Time. Every Thursday, I am here on KP Media TV, SCW channel, and on the streaming channels that we talked about before. Until next time, bye-bye.